Welcome back to Motors and Medicine. On today's episode, I'm going to be talking about ear infections. The reason I chose this topic is because it's a pretty common problem that affects a lot of pediatric patients and actually does happen to affect adults as well. Now, I'm going to talk a little bit about ear infections as far as what causes them, what the best treatments might be, and what to do about them when you are an adult if you happen to get an ear infection. Now, to start, what exactly is an ear infection? Well, inside the ear, you have your canal, and that's basically just the auditory passage where sound makes its way to hit your internal tympanic membrane, or your eardrum is what we call it, okay? And that eardrum, its job, it's basically meant to be a little bit of a convex, clear, transparent, like a snare drum, okay? And it's supposed to move and vibrate as sound passes through it. When that happens, the sound hits these three little bones that are inside behind the eardrum, and that's what transmits to your brain and kind of tells your brain what kind of sounds you're hearing, pitch, tone, all of that kind of thing, loud, soft. Now, there are two types of ear infections. The first is inner ear infection, or ear infections behind the eardrum, where those bones are. Now, inner ear infections are still common in pediatric patients, especially those who continually get sick on a regular basis or don't drain. So the eustachian tubes are tubes behind the eardrums that help to drain into the throat when you're sick, when you have buildup of congestion, things like that, and your sinuses. The eustachian tubes can become dysfunctional in pediatric patients, and it's basically an additive problem leading to more frequent ear infections. Now, when it comes to ear infections, managing them is pretty straightforward. If it happens to be a bacterial infection in a pediatric patient, okay, the three typical bacteria that cause ear infections in children are MCAT, H. flu, and S. pneumo. These are just the shortened variation names of these bacteria. They're still around, but unfortunately, it seems like nowadays, when I was still practicing urgent care, it seemed most of the time it was going to be a virus that actually caused the ear infection in most pediatric patients. Now, that's not always the case. There are bacteria, and these three particular bacteria that still cause those infections. But most of the time, it tends to be a viral infection that tends to creep in. Viruses have become a far more common infectious agent in ear infections, as well as throat infections, and sinus infections for that matter. Viruses have evolved, have become more virulent, more infectious, and especially now with the onset of all these different COVID variants, all these infections can hit the eyes, the nose, the ears, the throat. So it's not uncommon to see that as a more common cause for these ear infections. So if a pediatric patient does happen to get an ear infection and they go to the doctor looks in their ear and they see that it's super, super red, angry, bulging, even maybe a little bit draining. Okay, that's likely a bacteria, and the best treatment for that is to just do a course of antibiotics. Amoxicillin or Augmentin is usually a first-line treatment for that. Now, for any other infection that isn't bacterial, that's viral, and most of the time these viral infections tend to hit both ears pretty equally, rather than just one side, where some bacteria tend to be more one side than the other. Viruses tend to spread very rapidly to both sides. So that's one tell that it could be a virus. It's also not quite as angry or irritated, but it's more of a pressure problem. Sometimes the eardrum just looks a little bit opaque instead of transparent and clear like it should. In cases like that, just using a decongestant and maybe some ear drops for pain is probably the best way to manage that in a pediatric patient. Now, we're going to switch over to adults. What do you do to treat ear infections if you're an adult? Well, again, in an adult, bacterial ear infections are very, very rare. They can happen behind the eardrum, but they're pretty rare. more often than not in an adult, it's going to be a virus that causes the infection, whether it's a common cold, COVID, any type of other virus that kind of gets around the entire HEENT system, okay? So when it comes to treating infections as an adult, again, same thing. Some sort of decongestant, perhaps an antihistamine, some ear drops for pain, and then just give it some time. Unfortunately, ear infections can be a bugger because they'll cause a lot of negative pressure, which causes pain behind the eardrum, headaches, difficulty, muffled hearing, things like that. Unfortunately, there's really not a whole lot to do about infections of that nature. Now, we're going to switch over to the other type of ear infection, which happens to be external ear infection or otitis externa. The internal ear infections are otitis interna, okay? Well, now, otitis externa is, or one of the other terms is otitis media, if you want to say it that way. But otitis externa is basically just an infection on this side of the drum inside the ear canal itself. And that can be attributed to a number of things, anywhere from excessive cerumen buildup or wax buildup. It's very common in people who swim a lot, so we call it swimmer's ear. Also very common in people who get into, say, hot tubs and kind of submerge themselves in hot tubs a lot, or if for some reason you just happen to have ear canals that are a little bit smaller, then you can actually trap, foreign bodies in there, making it harder for the ear canal to get oxygen from the air. And when that happens, it allows proliferation of bacteria to occur. Now, otitis externa or external ear infections they're no picnic either, because if enough bacteria colonizes, I should say, it can be extremely painful. You lose your hearing, you get a ton of junk, purulent, bacterial junk that builds up in the ear canal, and then it'll start to drain out as well. Oftentimes people will say, I've been having all this pressure, and then they find a bunch of gunk on their pillow because it drains at night. So more often than not, that's going to be otitis externa. Now, the best method to treat that, because otitis externa tends to more often than not be bacterial versus viral. And when you see otitis externa and you've got a lot of drainage and pain, using a drop is the best method. So some type of antibacterial drop works the best. They're really not too expensive, and generally it's just a quick visit to the doctor to look inside your ear and see that you do have an ear canal that has been colonized with bacteria. So you're using drops, you clear it out. Sometimes you can do other alternative treatments, like the candles, hair dryers, any number of things that it's out there. Some people try it. Sometimes it works. But as far as the bacterial infection itself, antibiotic drops tends to do the trick. So this sums up the two different types of bacterial infections as far as otitis media, otitis externa, and then of course, when we talk about viral infections, like I said, in children it's very common and more common now than bacteria is. In adults, it's primarily going to be a viral infection that causes the inner ear infection. In adults, when it comes to otitis externa, or the outer ear infection, it's going to be bacterial infections that are more prevalent, as well as children, especially if the children are swimmers or do have a lot of wax buildup and the ear doesn't quite breathe the way it should. Every part of the body, including the inner ear, needs to have a certain level of oxygen hitting it, because oxygen acts as a free radical destroyer, and it helps to clear out some of that, mitigate some of that bacterial growth that can start to colonize. Now, aside from that, these ear infections tend to cause issues with not only headaches and muffled hearing, but also just pressure that becomes very intolerable. So that's why it's important to recognize whether you have an actual ear infection. If you let it go too long and it is a bacterial infection, it could potentially cause a rupture of the tympanic membrane, which we see a lot of in pediatric patients. If you're an adult and you've got a canal infection or even an inner ear infection that's just going on too long, you can also cause some problems there. And you can also attenuate the tympanic membrane or cause a hole to rupture. So it's one of those things where if you're getting a lot of pain, get it looked at. Make sure that you're not compromising your ear in any way. The problem with the eardrum is that once it gets infected multiple times and it starts to scar over, it doesn't move as much, and it doesn't transmit sound as well. So those are things to consider as side effects or byproducts of getting chronic ear infections. So hopefully this information was helpful to you guys. On the next video, I'm going to be jumping back into the Bronco. We're going to be doing some more part installs. But for now, regarding this video, if you like this content, please give it a thumbs up. If you haven't subscribed, please do so. It'll help the channel grow. And like always, just look forward to all the videos. Keep your notification bell on. That'll let you know when the videos are posted. And again, I appreciate all your support. And until next time, this is Motors and Medicine signing off. Thanks a lot.